In this video, I'm going to share with you 8 of my very best tips to quit smoking. These are the same tips that I share with our patients, and I'm going to share them with you starting right now. Howdy, Aaron Boster here with the Ohio Health MS Center, speaking today about a critically important topic, tobacco use and multiple sclerosis. Many of you have seen my video being 4 for 4 in your fight against MS. 4 for 4 are 4 things that I want you to do to improve your outcome. Take a disease-modifying therapy and make sure it's working, exercise, supplement vitamin D, and make sure you're not using tobacco. Recently, a patient of mine asked if I could expound a little bit on ways of trying to quit smoking. And in this video, I've prepared 8 of my very best tips to try to help you quit tobacco. If this is your first time tuning into the channel, thank you very much. Please take a moment to subscribe and click that notifications bell so you don't miss any of our upcoming content. Number 1, please get out a piece of paper and a pencil and write down for yourself the reasons why you want to quit smoking. Now, this might sound silly and you could say, yeah, I know all that. But I'm asking you to go through the process of writing it down. Just to briefly review with you, most of us know that quitting smoking lowers the risk for cancer, it lowers the risk for a heart attack or a stroke, it lowers the risk of developing dementia, and it quite literally extends our life expectancy. For people impacted by multiple sclerosis, it takes on a whole new value because we know that smoking increases the risk to develop MS. Secondhand exposure to smoke increases children's risk for MS. And if you have multiple sclerosis and smoke, it speeds up your disease by almost 50%. There are other reasons why it's a good idea not to smoke. Things like improving the quality of your skin, your hair, your nails, your teeth, your breath, and your body odor are all very real reasons why not to smoke. There are other things that we might consider as well. Saving money. Many people spend easily $6 a day buying cigarettes. And if you take $6 a day times 7 days, 42 bucks, you then multiply that by 4 weeks in a month, and then you start to calculate the amount of money spent in a year. It's very, very substantial. I could go on for quite some time, but I'm not going to. I'm simply asking you to write down on a piece of paper reasons why you want to quit smoking. And it's something that I want you to hold on to. Tip number 2 is to understand the psychology of quitting smoking. First off, there are 4 phases to quitting smoking. The pre-contemplative phase is a medical way of saying, talk to the hand, I'm not ready to quit. And if you are in the pre-contemplative phase, that's okay. I just want you to admit that to yourself. I'm not ready to do this yet. I get very excited when patients transition from pre-contemplative to the contemplative phase. The contemplative phase is probably where most people watching this video might be right now. It's where you're starting to think about maybe being willing to quit smoking. You would consider different techniques and it's something you're going to kick around in your head. And if you're in the contemplative phase, good job. The next phase is the action of quitting. And we're going to spend most of this video talking about how to get ready to enter into that action phase. The last phase is maintenance, arguably one of the hardest. And so I think it's very helpful for you to identify, am I pre-contemplative, contemplative? Am I currently in the action of trying to quit? Or am I now in a maintenance phase? Understanding this will help a great deal. The second point here is that quitting is hard. And in fact, the success rate long term for those that quit cold turkey is less than 5%. I'm going to say that again. People that just decide, I'm done cold turkey, have less than a 5% chance of being successful long term. And what that means to me is we have to do some proper planning and put some mechanisms in place if we're going to be successful. My last point as it relates to the psychology of quitting is 3, 3, and 3. The cravings that people experience when they quit smoking last on average 3 minutes. Keep that in mind. We're going to have to come up with a tool to combat cravings for 3 minutes. If you can get past those 3 minutes, the craving will subside. Cravings are peak during the first 72 hours or 3 days. So those first 3 days of quitting is when you're going to experience the most frequent occurrence of cravings. And the most impactful withdrawal lasts 3 weeks. So as you're preparing to quit, think about 3, 3, and 3. Cravings last 3 minutes. They're the worst during the first 3 days. And the majority of the physiologic withdrawal lasts 3 weeks. One other point. Please don't quit smoking during times of significant psychosocial stressors. Going through a divorce and quitting smoking, they don't make sense. Taking on a brand new job and quitting smoking doesn't make sense. You need to find a time to quit smoking when things are relatively at ease. Understanding the psychology of quitting is paramount to success in smoking and therefore represents my second tip. Tip number 3 is to leverage pharmacology. There are 2 prescription medicines that have been shown to be highly effective in helping individuals quit smoking. The first one is actually my favorite antidepressant, Wellbutrin. The long name is bupropion. And starting Wellbutrin 2 months or 1 month prior to the initiation of smoking is very, very valuable and has been shown in clinical trials to assist in quitting smoking. If you're trying to quit, and maybe you've had trouble in the past, talk to your provider about starting Wellbutrin or bupropion in preparation for quitting. The second medication is called CHANTIX. CHANTIX is a powerful medicine that removes many of the cravings and urges associated with quitting smoking. I've had great success in using Wellbutrin and CHANTIX in patients. Now, both of these medications have side effects that have to be discussed with your provider. I want to arm you with this information, though, so that you can ask them if you can have pharmacologic help as you prepare to quit. Another important tip, as it relates to pharmacology, is nicotine replacement. I mentioned earlier that quitting cold turkey is very unlikely to be successful long term. And many people benefit from nicotine replacement. And studies actually show that it increases success rates upwards of 70% in some patients. That's a big number. Nicotine replacement comes in lots of different flavors. A nicotine patch can be very helpful. I'll include in the description below some links where you can get free or discounted nicotine patches. Nicotine gum can be very helpful. And although it's controversial, many of us feel that vaping can be valuable. Now let me explain. If you're smoking an analog cigarette, you're sucking in nicotine as many other carcinogens are also being brought into your lungs. And the delivery system of nicotine in an analog cigarette is fixed. There's a certain amount of nicotine. I have had some patients that transition to an electronic cigarette or vaping. The advantage, one, is that you're still doing something with your hands and your mouth. And so there's an advantage there because you're not dealing with that psychology just yet. Also, when you're vaping an electronic cigarette, presumably you're not sucking in all the same carcinogens. You're just having a nicotine delivery device. Here's the key point. When you load up that e-cigarette with nicotine-laden juice, you can control the level. And so if you're systematic about it, each time you go back and buy a replacement of that nicotine juice, you can have a lower and lower amount of nicotine. And you can, over time, get down to the point where you're vaping no nicotine at all. And so I have had some patients that have found this to be very, very helpful. Tip number 4, success is handed to the well-prepared. There's a couple things that I want you to do in preparation for preparing to quit. I've done a video on quitting the 3 key cigarettes. And I'll put a link up above and I'll put the link down below in the description. And if you haven't checked that video out, you might find it helpful. In brief, many smokers have 3 to 4 key cigarettes. These are emotionally laden cigarettes. Oftentimes when I wake up, when I come home from work, after dinner, before bed. These are key cigarettes that provide nicotine, but they also provide an emotional benefit or a transition point. And I've used this technique with many patients over the years quite successfully. What I recommend is, and let's use the cigarette when I wake up as an example. Wake up in the morning and grab your cigarette and say, I'm going to smoke this cigarette in 1 hour, and then set the cigarette down on the desk and make yourself wait. You have not quit smoking yet, but you are teaching yourself to separate the emotional value of that time point cigarette from the actual nicotine. An hour later, go back and smoke that cigarette. And practice avoiding the key cigarettes. What you'll find is down the road when it's time to quit, almost all of the emotionally laden cigarettes are off the table and you'll be much more successful. For more information on this tip, check out that video that I mentioned. There are some other things that can be very helpful as we get ready to quit. I want you to set a quit date. Setting a quit date is a really big deal. Set a quit date at least a month in the future, and I need you to tell your entire village. I want you to call your grandma. I want you to tell your supervisor. I want you to tell all of your friends, hey guys, next month on this date, I'm going to start quitting. And it needs to be a public declaration. If you try to hide it, you're going to find that your success rate is much lower. Lastly, as we talk about preparation, I want you to consider the money that you're going to save not smoking. And I want you to set a reward or what you're going to do with that extra money. Write it down on a piece of paper and tell people, hey, I'm going to quit smoking. I'm going to save about $2,000 a year. And in that first year, I am going to buy blank. And I want it to be something that you set ahead of time a priori. It's a reward that you can look forward to as you start to embark on this action. Tip number 5 is to identify your triggers. Many smokers will find that certain triggers throughout the day cause them to reflexively grab a cigarette. And I need you to think critically about what those triggers are. Common triggers include seeing other people around them smoke. And so if you have a habit of meeting your girlfriend after work at 5 p.m. to smoke a cigarette, that's a trigger that you may need to avoid as you're getting ready to quit. A bar or a beer are very, very common triggers for people. And if you identify beer, cigarette, you need to identify that that's a connection, and you may need to avoid that as you prepare to quit. The smell of smoke is a very powerful trigger. And so in preparation for quitting, you're going to have to do some hardcore cleaning. I'm talking about vacuuming the floor, cleaning the drapes in your house, changing the bedding, having your clothes laundered, vacuuming out your car. You quite literally need to remove the trigger. Seeing cigarettes, seeing ashtrays around your house. These are all things that can trigger. And so write down what your triggers are. And in the pre-contemplative phase of quitting, prepare how you're going to combat them. Tip number 6 has to do with preparing to combat cravings. As mentioned earlier, cravings occur most frequently in the first 3 days when you quit, and they typically last for 3 minutes. And you need to have a plan in place when you experience a craving what you're going to do. Many people find that chomping on some celery or grabbing a carrot stick or shoving your mouth with a handful of nuts to chew on can be very helpful to combat that craving. By the time you finish that second carrot stick, 3 minutes is gone and the craving decreases. I'll share a fun story. When I was in college, a friend of mine was trying to quit smoking, and he was a martial artist. He carried in his pocket one of those grippers for hand strength, and when he felt the urge to quit, he would whip it out and squeeze the heck out of it until he was done. It was funny because we would be in the middle of a conversation and suddenly, and then he would say, sorry, go on. It was a wonderful way for him to combat cravings while strengthening his grip strength for his martial arts. I need you to identify what you're going to do when you have a craving. Could you drop down and do 15 push-ups? Come up with a tool in place so that when the craving hits, you're prepared. Tip number 7 involves making a lifestyle change. You have constructed a life as a smoker which involves smoking, and you need to work towards replacing aspects of your lifestyle. I strongly recommend changing your routine. Take a different route to work. Consider doing different activities as you're getting ready to quit. You're going to need to find a different place to hang out, for example, if your hangouts typically involve cigarettes or friends with cigarettes. One very helpful tip is to start moving. Use exercise as a tool to change lifestyle and to diminish smoking. Make sure that you're getting exercise because this will replace endorphins that you're missing, and it's something that you can actively do. So your dog's been begging you to go on a walk. Take the dog on a walk. Changing your lifestyle can be very, very helpful. And I want you to think about small, multiple changes that you could make as you get ready to quit smoking. Tip number 8 is arguably the most important. Couples must quit together. If you're a smoker and your significant other is a smoker, and you need to quit because of the multiple sclerosis, because of the risk factors, because of a multitude of reasons, it is imperative that your partner quit with you. Because if they don't, when you hear the crinkling of the paper, of the carton of cigarettes, when you smell the smoke on his jacket, or when you see him smoking outside, it's going to be almost impossible to quit. I need you to have a heart-to-heart with your significant other. Share with them your desire to quit. Share with them the list that you made of the reasons why you want to quit. Tell them about your quit date and ask them to please quit with you. There you have it. 8 tips to help you tackle tobacco and to quit smoking. My name is Boster with the Ohio Health MS Center, and I would love to hear from you. Please leave your comments and questions below and share with me what's worked for you and what's not worked for you. I would love to learn and share with others tips and tricks that you might bring to the table to help quit smoking. Until my next video, take care.